Good evening, everyone. Maybe good morning for some of you. So today I'm going to present to you the canal preparation with only one instrument that is used in reciprocation without glide path and without prior using of hand instruments. Definitely, I want to define what a glide path is at this stage, just to be sure that we understand each other. A glide path is a minimum canal enlargement that is usually required before using a rotary instrument. For most rotary systems, we have to create a glide path to a size 15 or 20 hand file before using the rotary instruments. So in this technique that I'm going to present today, we will use one instrument in the majority of the canals in reciprocation with, without glide path, and even in the majority of the canals without prior usage of a hand file. There are some cases where we will have to create a glide path. There are cases where we will have to use hand files before using the reciproc instrument, and I will discuss this later during the presentation. So you can see on this slide here the molars, this molar with 4 canals. These canals were prepared with only one instrument used in reciprocation, and again here without any prior hand filing and without creating a glide path. I'm going to show you a video clip right now. This is the first video clip that I did on reciprocation. This was done in 2001 at the University of Toronto. In that clip, at that time, I was using the F2 proTaper instrument in reciprocation. This is how I started the concept. It was with an F2 proTaper. And again, as I said, this is the first video clip that I had of this technique from 2001. I will discuss later in the presentation the clinical aspect of the technique using the reciproc instrument. You can see also on this slide here the radiograph showing the second maxillary molar. The 3 canals that you see here were also prepared with only one instrument without creating a glide path and without using hand files prior to the reciprocating instrument. Are you able to see the video clearly? Can anyone tell me? Great. In case there is something that you miss or that you cannot see clearly, this webinar will be available online. If you wish, we can send you the link for the webinar offline later, at a later date. So as I said, that was the F2 proTaper used in reciprocation. So one instrument just to prepare this canal here in the resin block. So this concept, this new concept, is a paradigm shift. It is a paradigm shift because it goes against the current teaching standards, which require us to use sequentially different instruments to obtain the desired shape. In this new concept, we are using only one instrument. And also it is a paradigm shift because it goes against the current teaching standards, which require us, as you know, to create a glide path before using an engine-driven instrument. In this new concept, a glide path will not be created in most of the cases. The instrument will follow the path of least resistance, which is the canal. Of course, in some cases, we will have to create a glide path, and this is something that I will discuss later. Also, you can see on this slide the radiograph of the second molar with an abrupt distal curvature. Although the curvature here seems to be abrupt, this canal was prepared with only one instrument used in reciprocation and without any prior hand filing, without even creating a glide path. In this presentation tonight, I'm going to discuss the limitations of the current preparation techniques. Then I will discuss the different types of instrument fracture. This part is very important to understand the concept of only one instrument, and it is also very important to understand the concept of no glide path. In the second part, I will tell you the story of reciprocation, how the idea was developed. Then I will describe the reciproc system. I will describe its use for an initial canal preparation and for a root canal retreatment. In the third part, I will discuss briefly a short-term outcome evaluation based on my cases, and then I will answer some questions that I'm always asked. So I will post the questions here and I'll answer them myself. And at the end, if you wish, we can have a discussion. If you have any questions, you can type for me the questions, and then I will answer directly to you. I need to start with the limitations of the current preparation techniques because I want to have a flow in this presentation, which is very important to understand the rationale of single file reciprocation without a glide path. Now there are many hand instrumentation techniques using hand stainless steel instruments. There is, for example, the serial preparation of Schilder. There is the step back technique. There is the balance force technique from Rome. All these techniques can be very good techniques. However, those techniques require the use of numerous instruments in numerous steps, and they are time consuming. When I studied endodontics, I was taught the serial preparation of Schilder. If I were to prepare the canal that you see on the radiograph here, the distal canal, if I were to prepare this canal with the serial preparation of Schilder, I would use 14 instruments between hand files and reamers. And I would also have to use 4 Gates Glidden drills. So the question is, why do I have to use so many instruments when I can obtain the same shape with only one instrument, as in this case? These techniques have also a very long learning curve, as you probably know. We know also that with stainless steel instruments, there is a higher incidence of canal transportation. And at the end, there is the frustration in some cases that results from the use of hand instruments, especially in patients where we have a limited mouth opening. Then there are the techniques using the nickel titanium hand instruments. We know from research that with nickel titanium, the chances of canal transportation are lower than with stainless steel instruments. So definitely that is an advantage. However, the hand instrumentation techniques using nickel titanium instruments still require numerous instruments. They are time consuming, and there is still the frustration that can result from the use of hand instruments in some cases. And finally, there are the nickel titanium rotary instrumentation techniques. You can see this molar here, this first molar with a severely curved distal buccal canal. This molar was treated by my friend and colleague here in Toronto, Dr. Dagger. For the preparation of the distal canal, he used, in this case, the proTaper system. With the proTapers, he had to use the SX, the S1, the S2, and the F1 proTaper. He also had to use Gates Gliddon's number 1, 2, 3, and 4. So the question is, again, why do we have to use so many instruments when we can do a similar canal like this one with only one instrument used in reciprocation and without glide path? In this case also, Dr. Dagger had to create a glide path. He had to use here files number 8, 10, and 15 to the working length. He had also to use a hand file number 20 to where the curvature starts. So the question is again, why do we have to use so many hand instruments to create a glide path when we can prepare a canal as severely as curved as that one without having to create a glide path, without having to use path files? The problem here is not only with the number of instruments that we are using. I think you all know that it is not easy to obtain patency in these canals. And once we obtain patency, it is not easy to maintain this patency. It's not easy to create a glide path in a severely curved canal like that one. No matter how skilled we are, this is a canal where we can cause problems just because we are using hand instruments. So the question is, why do we have to use these hand instruments to check patency, to obtain patency, and to create a glide path if we are able to do these cases without a glide path? Again, I just want to remind you here that there are some cases where we have to create a glide path, but the majority of the cases, even severely curved canals like this one, will not need a glide path. And this is what I will discuss later when I present some cases. Now, the nickel titanium rotary instruments, like the other techniques, also have a relatively long learning curve. Now I want to discuss the different types of instrument fracture. As I said earlier, this is very important to understand the concept of only one instrument and to understand the concept of no glide path. You probably are familiar with different types of instrument fracture, but I have to discuss this briefly in a way, because as I said, there should be a flow in the presentation for you to understand the rationale of this new concept. Are you able to hear me well? Are there any issues? Yeah, can anyone answer me? Are you able to hear me well? Okay, thank you, Victoria. At least I know that you can hear me well. So there are different types of instrument fracture. There is the fracture that is caused by flexural fatigue. Then there is the fracture that is caused by torsional fatigue. And there is the fracture that is caused by binding, or what we call torsional fracture. Now, the fracture from flexural fatigue will happen when we use an instrument in a curved canal. So the repeated usage of the instrument in that curved canal will subject the instrument to cycles of tension and compression, which at the end will fatigue the metal and the instrument will fracture, as you can see in the mesobuccal canal of this second maxillary molar. There are many studies, these are only two, that have shown that the use of reciprocation increases the resistance to flexural fatigue. So flexural fatigue isn't a serious issue in single file reciprocation because of that, but also because with this concept, it is recommended to discard the instruments after each case. So if there is any flexural fatigue, it won't be a problem because that instrument will not be used for a second case. The second type of fracture is the fracture that is caused by binding, and this is what we call torsional fracture. If you look at this first maxillary premolar, you will see that there is an instrument that was fractured in one of the canals. That was a new rotary instrument. It was a new instrument, and the canal is not curved, it's quite straight. So obviously here, the instrument did not fracture because of flexural fatigue. This instrument has fractured because it bound in the canal, because of binding. What happens when we use a rotary instrument, the instrument can bind in the canal during the rotation. When it is binding, it will be subjected to stresses where it is binding, usually at the tip of the instrument. This is what we call, in a way, torque. The motor keeps rotating the instrument. The stress on the instrument increases, and at some point, the stress will cause the instrument to fracture. This is fracture from binding, or this is torsional fracture. And this graph here illustrates what happens when an instrument fractures from binding. So the instrument is binding, there is stress on it, and the stress is represented by the y-axis with the torque. The motor rotates the instrument. This is what is represented by the x-axis. So with the rotation, the torque on the instrument, the stress on the instrument will increase, and at some point, the stress will cause the instrument to fracture. On this graph, for this example, the instrument fractured at 100 gram centimeters. This is the torque at fracture of the instrument. And this instrument fractured after rotating almost 1,200 degrees, which is almost 3 complete turns. For each instrument, we can determine the torque at fracture and the angle of rotation at fracture. So, in clockwise rotation, in order to minimize the chances of torsional fracture, manufacturers introduced torque control motors. So what they did, they determined the torque at fracture of the endodontic instruments, of the rotary instruments. And then they chose a value that is lower than the torque at fracture of that instrument, and they set that value on the motor. Let's take this example that we have here. This is an instrument that has a torque at fracture of 100 gram centimeters. So we determine the torque at fracture of the instrument. Here it is 100 gram centimeters. what the manufacturers do, they choose a lower value, let's say 50 gram centimeters, and then they set this value on the motor. When the instrument binds in the canal and the motor is rotating the instrument, it will be subjected to stress, to torque, which will increase with the rotation. When the stress on the instrument reaches the value set on the motor, for this case it is 50 gram centimeters, the motor will reverse the rotation. And theoretically, according to the manufacturers, torsional fracture will be avoided. However, I have done many studies to evaluate the torque control motors, and I found that the torque that is set on the motors is always higher than the torque at fracture of the instrument. So for example, instead of setting 50 gram centimeters for this instrument on the motor, a higher value than the torque at fracture, higher than 100 gram centimeters, was set on the motor. So in a way, the torque control feature on these motors was useless. The other way to minimize the chances of torsional fracture is by minimizing the chances of binding of the instrument in the canal. And this is where a glide path is important. The glide path concept was created for the rotary instrumentation techniques, because when we use an instrument in clockwise rotation, it will likely bind at some point in the canal. And we know that when an instrument binds, the instrument will fracture because the motor is rotating the instrument at 300 gram centimeters, and we do not know that it is binding. So with the glide path, we know from studies that with the glide path, the chances of binding are less, the torsional stress is less, and therefore the incidence of torsional fracture is lower. The glide path can be created with hand files. However, if you look at the smaller here, at the distal root, which has a severely curved canal, you know it is not easy to use hand files here to create a glide path. No matter how skilled you are, it can be very challenging. We have to use here number 8, number 10, and number 15 hand files probably. And again, this can be extremely challenging. The 8 can go easily. It will be more difficult to place the 10 at the working length, and it will be even more difficult to place the number 15 hand file at working length. So maintaining the glide path can also be very difficult. And this is a case where we are more prone to cause complications. A glide path isn't created only because we want to have a minimum enlargement in a curved canal, but it is also important for rotary instruments when the canals are very calcified. The glide path can also be created with engine-driven instruments, like the path files from Dentsply. I don't know if you are familiar with the path files. The path files, there are 3 path files. These are very good instruments to create a glide path. However, if we were to create a glide path using these instruments, for example, in this model here, we have to use these 3 instruments. So these are 3 additional instruments to be used, but even before that, we have to use a number 10 file. So we are back to the problems of using a hand file in a narrow and curved canal. So the question is again here, why do we have to use so many files to create a glide path in a canal like this one, when we know that the majority of the cases can be done without a glide path, and the majority of the cases using single file reciprocation. So In reciprocation, what we do, we are not interested with the torque at fracture. We are interested with the angle at fracture. So in reciprocation, in single file reciprocation, we determine the angle at which the instrument will fracture if it is rotated when it is binding. For this example here, the instrument will fracture at around 1200 degrees. So after doing 3 complete turns in rotation when it is binding, it will fracture. So in single file reciprocation, what we do, we will choose an angle that is lower than the angle at fracture of the instrument. Let's say 800 degrees. We set that angle on the motor. When we use the instrument in the canal in reciprocation, when the instrument reaches 800 degrees, the motor will reverse the rotation, and so on. The motor will keep reversing the rotation when the angle that is set on the motor is reached. And this angle is much lower than the angle at which this instrument would fracture. So in a way, by using an angle like this one, the chances, the fracture from binding is eliminated. And we know already from a study, Varela Patino, we know that in reciprocation, there is even a lower chance of binding of the instrument in the canal. Not only because of the angles, but also because of the movement that we are using. And this is what I will explain later. The last type of instrument fracture is the fracture that is caused by torsional fatigue. And this is one type of fracture that has not been studied enough in endodontics. When we use an instrument in a canal, a rotary instrument in a canal, this instrument will touch the canal walls. It will engage dentine and cut dentine. So when it does that, it is being subjected to stresses. The repeated stresses in rotation while cutting and engaging the canal walls can cause metal fatigue, which ultimately can cause the instrument to fracture. This is what we call fracture from torsional fatigue. This is the most important part to understand the concept of single file reciprocation without glide path. If you look at this chart, this illustration here, you can see that there is a steep curve and there is a flat part in this curve. The steep curve corresponds to the elastic phase of the instrument, this one here. The flat curve corresponds to the plastic phase of the instrument. Now, when we use an instrument in a canal, the instrument will be subjected to stresses in rotation from cutting dentine and engaging the canal walls. These stresses can cause changes in the metal. These changes can be reversible or irreversible, and this will depend on the degree of rotation of the instrument when it is binding. If you look at this graph here, you see the elastic, what we call the elastic limit. The elastic limit is the level at which the elastic phase will change into the plastic phase. If we take an instrument, and if this instrument binds in the canal, and is rotated beyond the elastic limit into the plastic phase, which is here beyond 400 degrees, the instrument will be in the plastic phase. And once it is in the plastic phase, that means the changes in the metal are irreversible. However, if the instrument rotates to a degree when it is binding lower than the elastic limit, which is in this case at 400 degrees, the changes will be reversible. And the reversible changes happen only in the elastic phase. So as I said, the changes in the metal of the instrument will be reversible or irreversible depending on the degree of rotation of the instrument when it is binding. To summarize, if the degree of rotation when the instrument is binding is below the elastic limit, the changes are reversible in the metal. If the degree of rotation is beyond the elastic limit, more than 400 degrees for this example, the changes are irreversible. So in single file reciprocation, what we do, we determine the elastic limit for an instrument. For this example, the elastic limit is determined at 400 degrees. And then we choose an angle that is lower than the elastic limit, and we set that angle on the motor. So we know that the instrument will rotate that angle, we know that the motor will rotate that instrument to that angle and then reverse. That will rotate it to that same angle and reverse. So we will have the reciprocating movement. So because the angle that we chose is lower than the elastic limit, even if the instrument binds in the canal, even when the instrument engages the canal walls, the stresses to which it will be subjected will cause only reversible changes because the instrument is still in the elastic phase. And therefore, in single file reciprocation, where we use an angle that is lower than the elastic limit, torsional fatigue is theoretically eliminated. And this is what makes single file reciprocation very successful. The use of an angle that is lower than the angle at which the elastic limit develops. I'm going to show you here a video that shows that binding does not happen, and that shows that torsional fatigue is in a way eliminated. You will see here a reciproc instrument being used in this canal in one shot. So no irrigation, no patency. It will go from the coronal orifice to the apex in one shot. And this explains that binding does not happen and that torsional fatigue resulting from the cutting will not happen, as you will understand. And this is done with a reciproc instrument. So the irrigant is placed in the canal, and now you will see the reciproc instrument being used in one shot from the orifice, from the coronal orifice to the apex, without removing the instrument from the canal, without cleaning the instrument, without checking the patency. You understand, you know that you cannot do this with any other instrument. And this is possible because, one, binding doesn't happen, and second, because torsional fatigue is theoretically eliminated. This is not how we use the reciproc instrument, but this is a video I wanted to show just to make understand the efficiency of the concept and to make understand the issue of torsional fatigue and binding. Now we know from studies that new instruments may have defects, they may have cracks. And this is why torsional fatigue will still happen. If we have an instrument that has a crack, a new instrument that has a crack, the repeated engagement of the canal walls will open up the crack, and the crack can cause fracture of the instrument. So although theoretically torsional fatigue is eliminated, but practically it can still happen if there are defects on the new instruments. So now you understand why a glide path is not required. It is not required because the angles that we use are smaller than the angle at fracture. Even if the instrument binds at the canal, it will not fracture. A glide path is required for rotation, continuous rotation, because there is a high chance of binding. By creating a glide path, we're decreasing the incidence of binding. In reciprocation, because of the angles that we use and because of the movement that we are using, binding will occur much less frequently, and even if the instrument binds, it will not fracture. So the question is, how can we use an instrument like the reciproc, which is a large instrument? The reciproc has dimensions similar to the F2. So how can we use an instrument similar to the F2 in very narrow canals without a glide path? This is how I prepare the MB2 canals. I never start with the hand file. I never create a glide path. I always start with the reciproc instrument. How can that instrument go into a very narrow canal like the MB2, which can sometimes be also strongly curved? How can that be without any problems? That is because of several factors. The reciproc instrument is very efficient in cutting dentine. So when we use this instrument, it will cut very efficiently. This is probably one of the most efficient instruments. I don't know if you are familiar with the M2 instrument. The M2 instrument is a rotary instrument which also has a great cutting ability. The reciproc instrument has a similar design to the M2 instrument. So the reciproc instrument is very efficient in cutting dentine. So we place it at the orifice of the canal. It will start cutting in the canal. It will follow the path of least resistance, which is the canal. Now, no matter how calcified the canal will still be less resistant than the surrounding dentine. So an instrument that cuts very well, where will it go? It will follow the path of least resistance. We are using this instrument in reciprocation. We know from the study of Ron in 1985 that with reciprocation there is a lower chance of canal transportation. And we are also using this instrument, which is made from nickel titanium, so it is a flexible instrument. So we have an instrument that cuts very well. It will go into the canal. It will not transport or ledge the canal because it is used in reciprocation and because it is a flexible instrument made from nickel titanium. We know that this instrument can go even in very narrow canals because even if it binds, it will not fracture. It will not fracture because the angles that are set on the motor are much lower than the angle at fracture of the instrument. We also know that the instrument will not be subjected to torsional fatigue, or torsional fatigue will be very low. And that is because the angles that we use are lower than the angles at which the elastic limit, they are lower than the elastic limit. So they are lower than the angles at which the instrument will be subjected to irreversible changes. So for all of these reasons, a large instrument like the R25, which is similar to the F2 proTaper instrument, can go in most of the curved and narrow canals without needing to create a glide path. And well, today I want to present to you this new concept using the canal preparation with only one instrument used in reciprocation without creating glide path in most of the cases, and even without the need to using hand files before using the reciproc instrument. So it all started for me in 1985 when James Strong published a study on the balance force technique. In the balance force technique, we use stainless steel, hand stainless steel instruments. So James Strong was able to show that very strongly curved canals can be prepared with stainless steel instruments, with large stainless steel instruments, which are rigid, quite safely. So from that study, it was obvious that reciprocation is very important to maintain the canal curvature. Then later, I was testing prototypes of proTaper instruments, and I knew that the proTaper instruments can also cut in reciprocation. And at the same time, ATR, it is a company that was based in Italy, and they used to manufacture the ATR motors. They sent me an ATR motor to evaluate. They knew, when I was teaching, they knew that I was doing studies on instruments and motors. So they sent me a motor to evaluate. And interestingly, that motor had a reciprocating feature. So I started trying things. You know, I had a motor that has reciprocation. I had an instrument that would cut in reciprocation, and I knew that reciprocation from the study of Fron is very important to maintain the canal curvature. So I wanted to try and simplify the root canal preparation. So I started trying, instruments. And then I discovered, just from trials and errors, I discovered that I was able to prepare that canal in a resin block with only one F2 proTaper instrument. So this is how the idea came to my mind. And that was the first paper that I published on the use of the F2 proTaper in reciprocation. That was published in 2008. So I used the F2 proTaper for many years, probably for just in single file, for probably 6 or 7 years, and no other techniques. However, I still had some issues with it. The F2 proTaper, if you are familiar with it, is quite rigid, and also with the F2 proTaper, I always needed to create a glide path. And you understand now my opinion about the creation of a glide path. This concept the glide path can be a very challenging step. So I wanted to move away from the glide path concept. When we teach, don't we say, if you are able to prepare the canal to a size 15 hand file, the preparation is almost complete? What does that mean? That means the canal preparation from 8 to 15 is the most critical step. Once we are able to put a number 15 hand file at length in a curved or calcified canal, everything becomes easy. So with the F2 proTaper, I still had to create a glide path. And also with the proTaper, because of the design of the instrument, I had frequently untwisting of the flutes. So I wanted to have an instrument that was better than the F2 proTaper. And this is when I started working with Dentsply on instruments for single file reciprocation. And then we developed with Dentsply the reciproc instrument and the Wave 1 instrument. So both instruments are from Dentsply, and they are both single file reciprocating instruments. Now these instruments were much better than the F2 proTaper. We know from research that was done recently that these instruments, they have an increased fatigue resistance and they have an increased torsional resistance. This was the first paper that I published online on the canal preparation on single file reciprocation without a glide path. You can find this paper, you can download it on the link that you see there, endodonticcourses.com. Now, as far as I am concerned, I definitely prefer the reciproc instrument on the Wave 1. The reciproc instrument is a better instrument because for two reasons. First, a glide path is not needed in most of the cases. With Wave 1, a glide path is needed in every case. Second, and this is a very important reason, the reciproc instrument is very efficient for root canal, excuse me, is very efficient for root canal retreatments, whereas the Wave 1 cannot be used for root canal retreatments. And I will discuss retreatments also later in the presentation. But these are the reasons for which I personally prefer the reciproc instrument over the Wave 1 instrument. Now, the reciproc system has three instruments. There is the R25, that is the main instrument. The R25 has a diameter of 0.25 millimeter at the tip. Then it has an 8% taper over 3 millimeters. And then there is a regressive taper. So the taper after 3 millimeters decreases. Then there is the R40, which has a diameter of 0.4 millimeter at the tip. Then it has a 6% taper of over 3 millimeters. Then the taper decreases beyond that point. The R50 has a diameter of 0.5 millimeter at the tip, a 5% taper over 3 millimeters, and then a decreasing taper. Now, this slide shows the cross-section of the reciproc instrument. For those who are familiar with the M2 instrument, the reciproc instrument is very similar to the M2 instrument. There were some modifications that were made on the pitch of the instrument, on the number of flutes and the helical angle. These instruments are made from a nickel titanium M wire. We know from research that the use of an M wire gives a greater resistance to cyclic fatigue. It gives a greater resistance to torsional failure. Also in the reciproc system, there are matching paper points, and there are matching gutta-percha cones. And there will be, in the future, shortly, there will be matching obturators like the gutta core or thermophil, but for the reciproc system. This is the reciproc motor. The reciproc motor can also be used, if you want, for clockwise rotation. Now, I will show you here a video just to show you the reciprocating movement. So the speed that is used is around 300 RPM. The motor, the instrument will make 10 cycles per second. A cycle is one clockwise rotation and one clockwise rotation to the angle that is set on the motor. So that is one cycle. So the motor will rotate the instrument 10 cycles per second, so it is quite fast. Now you understand that the angles that are set on the motor are specific to the reciproc instrument, because these angles are based on the elastic limit of the reciproc instrument. And this means that you should not use the reciproc instrument with other motors. You may be successful using it with other motors. As you know, there are already some motors available to use reciprocation. So you may be successful with these motors in many cases, but will have problems in some other cases. Now I want to show you a video that demonstrates the technique of single file reciprocation with the R25 or the other reciproc instruments. So the instrument is used in very small in and out motion, very small in and out movements. The amplitude of the movement should be about 3 to 5 millimeters, and we do a series of in and out movements that I call packs. We do 1 pack, 2 packs, 3 packs, then we remove the instrument like I did here. We irrigate, we check patency, and then we go back. 1 pack, 2 packs, 3 packs, take it out, irrigate, patency, and then we continue. We keep doing this until the instrument reaches the working length. You do not apply pressure on the instrument. You will see that the instrument will advance very easily in the canal. Again, very small in and out movements, 3 to 5 millimeters, 3 times, you take it out, you irrigate to clean. You have to take the instrument out after 3 packs to prevent binding of the instrument in the canal. Sometimes the instrument can go very easily in the canal that you will be tempted to let it go in the canal. This is when the instrument can bind. So very small movements, in and out movements, 1 to 3 times, you take it out, irrigate, check patency. Now when you use the reciproc instruments, you can also use the instrument in a brushing movement. The brushing can be done at the beginning of the canal preparation to obtain a straight line axis, or it can be done during the canal preparation or at the end of the canal preparation to have a greater taper. Now, before I forget, I just want to mention that the principles of axis, so the axis cavities, the principles of straight line axis, and the irrigation protocols do not change. They remain the same. So they are similar to what we do with clockwise rotation. So the first step is to choose the reciproc instrument that we want to use for the canal preparation. The selection of the reciproc instrument will be based mainly on the preoperative radiograph. If the radiograph shows that the canal is partially or completely invisible on the X-ray, then we assume that the canal is narrow, and this is a case where we would do the preparation with the R25, with the reciproc 25. I'll give you examples later. If the canal is completely visible on the radiograph, then we assume that this canal is quite wide. And in these cases, what we do, we take a hand instrument number 30, straight, we do not recurve it, we take a hand instrument number 30, we put it in the canal, without any wash winding, without any cutting, we put it straight in the canal, just straight. The instrument will either reach length or it will not reach length as indicated by an apex locator. If the instrument reaches length passively without any cutting, then we know that the canal is very wide, and this is a case where we will use the R50 for the canal preparation from the beginning, no other instruments. As long as the number 30 hand file, which is straight, goes to length without any cutting. It has to reach length very passively. If the number 30 hand instrument does not reach length, we should not force it to reach length. We then take a number 20 hand instrument and we do the same test. If it goes to length passively without any cutting, then we use the R40. If at this stage the number 20 hand file does not reach length, then we know that there might be a complex anatomy apically. These are cases where we would either use an R25, but most probably these are cases where we would actually create a glide path before using the R25. So basically, this is how we choose the instrument that we will use for the canal preparation. Now, you can see this first model. The radiograph shows that the canals are either completely invisible or partially visible. This is a case where the canals will be prepared with the R25. In some cases, the root anatomy will dictate the reciproc instrument to use. Obviously here, I'm not going to use the R40, which has a 6% taper, to prepare this canal which has an S curvature. This is a case where I would use the R25. There are some cases, like this one, where the canal is completely visible on the radiograph. In this case, we will use either the R40 or the R50, depending on the test that we will do with the hand file. So once we select the reciproc instrument, we will estimate the working length from the preoperative radiograph. Then we will put the stopper on the instrument at 2/3 of that estimated length. We'll take that instrument, and we start using it as I described earlier. 1 to 3 packs, take it out, irrigation, patency. Patency means I would take a number 8 file, put it in the canal to the length that was reached, by the R25 instrument, or length plus 1 millimeter, just to check that the canal beyond the level that was reached by the reciproc instrument is not blocked. We keep doing this until the R25 reaches the estimated working length minus 4 or 5 millimeters. Once at that stage, we have to determine the length. This is where we will take a hand instrument, put it in the canal, determine the working length, and then we continue with the reciproc to the working length. Now, the working length determination is a very important step when we use the reciproc instruments. It is an important step because it is what will let us know if it is safe to continue with the reciproc instrument to the working length or not. So again, once the reciproc instrument reaches the estimated length minus 4 or 5 millimeters, we would then take a hand instrument, number 8 or 10, straight. We do not recurve it, and again, this is against the current teaching standards. We take a hand instrument, number 8 or 10, straight. We put it in the canal with watch winding until it reaches length. If the straight hand file reaches the length as indicated by an apex locator, then we know that even if the curve is severe, we know that this curvature is gradual. Then we know that we can use the reciproc to the working length. However, if the number 8 or 10 file that we are using to determine the working length does not reach the working length unless we pre-curve it at the tip, then we know that the anatomy in the apical third is complex, and this is a case where we will then have to create a glide path before using the reciproc instrument. And this is why, again, I said that this step of the working length determination is very important. Actually, this step is not special only for single file reciprocation, but this is also what we have to do if we were to use the rotary instruments in a safe manner. Every time we have to pre-curve an instrument to reach length, we know then that there is a complex anatomy. And then an engine-driven instrument should not be used there unless we create a glide path. Now, after creating the glide, after creating the glide path, if the instrument, the hand instrument, can go straight in the canal without pre-curving, we know that we can use then the R25 to length without any issues. But if after creating the glide path, for example, to a size 15 file, the number 15 file does not go to length unless it is pre-curved, then I know that this is a case where I should not use the R25 to the working length. This is a case that has to be finished with hand files. And this is what we also would do in case we are using rotary instruments. And again here, I just want to remind you that the irrigation protocols, patency, the axis cavity guidelines, and the guidelines for a straight line axis do not change. Now, talking about straight line axis, we do not use with this concept any orifice openers, we do not use any drills. The straight line axis will be obtained with the reciproc instrument itself by brushing. And this is very important because with the reciproc instrument, we obtain the straight line axis that is needed to allow the instrument to progress in the canal. We do not over-prepare the canal in the coronal third to obtain this straight line access. And this is very important as far as the prevention of vertical foot fractures is concerned. So it is a conservative way to obtain a straight line access. Now, if you look at the radiograph on this slide here of the first molar, the canals are partially invisible on this radiograph. So this is a case where the R25 was used for the canal preparation. Now, you probably know that there are two different approaches for canal preparation and for the final size of the apical preparation. The purpose of this presentation is not to discuss increased apical enlargement. If you wish, after using the R25 to have a larger canal preparation, then you can do that. If not, you can just start with the R25. Now, for this case, the working length was estimated from the radiograph. A stopper was placed at that estimated length minus 4 or 5 millimeters. The instrument, the R25 here, was used as described with a packing motion, 1, 2, 3, very small movements, taken out, patency, irrigation. We continue doing that until the instrument reaches the estimated working length minus 4 or 5 millimeters. Then a hand file, number 8 or 10, straight, is placed in the canal to determine the working length with an apistocator, preferably. If the instrument number 8 or 10 reaches the working length without having to pre-curve it at the tip, then we know that the curvature is gradual, and that was the case here. Then we know that it is safe to continue with the reciproc to the working length. Now, as I said earlier, the straight line axis here is not done, and you can tell from how conservative the canal preparation is in the coronal third. The straight line axis is not done with ultrasonics or Gaze-Glidden drills or any other instruments. It's only done as needed with a brushing motion with the reciproc instrument. You probably are aware that vertical root fracture is now a major concern, and we are aware that an over-preparation of the canal, mainly in the coronal third, is responsible for many vertical root fractures. So this is a case where hand files were not used actively, no hand filing was done, and a glide path was not created in this case. Only one instrument was used for the canal preparation. This is other case with a more severe curvature. Same approach. The working length is estimated from the radiograph. A stopper is placed at the estimated working length minus 4 or 5 millimeters. The reciproc is used in small packing motions, 1, 2, 3. We take it out, irrigation patency. Once the instrument reaches the estimated working length minus 4 or 5 millimeters, in this case, a number 8 file was placed, straight 8 file was placed in the canal with watch winding. It went to length. I did not have to pre-curve the canal. So although there is a severe curvature, I know that this curvature is gradual, and then I know that I can use the reciproc safely to the working length. So it is important to know whether a curvature is gradual or abrupt, and this can only be known from the use of a hand file number 8 or 10 in the canal during the working length determination. And again here, I just want to put emphasis on the fact that the coronal enlargement is quite conservative. And again, this is a very important issue. Now we'll have the same approach regardless of the canal anatomy. These are canals that have an S curvature, double curvature. We will approach them in the same manner. So, estimated working length from the radiograph, stoppered at 4 or 5 millimeters short of the estimated length, reciproc to that length minus 4 or 5 millimeters, and then working length determination with the hand file straight. If it goes to length, as it did here in those 3 cases, without pre-curving, then we know that these curvatures are gradual, and then we know that we can use the reciproc safely to the working length. What is important with this technique, with this concept, is that regardless of the difficulty of the case, regardless of the canal calcification, regardless of the curvature, the approach is always the same. Nothing changes. In some cases, we will use some other instruments. Like in this case here, the mesobuccal canal was done exactly in the same manner that I described, with one reciproc, the R25, that was taken to length, and you can see the R25 and the radiograph in the center. Although this is a severe curvature, this curvature was a gradual curvature, and I knew that during the working length determination, because I did not have to pre-curve the hand file to reach working length. Now the palatal canal, in the palatal canal I use an R50. Before I started using the R50 in the palatal canal, I did a test with the hand instrument. A number 30 hand file was able to reach length passively without any filing in the palatal canal. So I knew then that this was a wide canal, and in that case I used the R50 exactly in the same manner for the canal preparation. So you understand that in some cases we'll have to use more than one reciproc instrument. It is not anymore a pure single file reciprocation. It is a single file reciprocation in one canal and single file reciprocation in another canal. But in this case, 2 instruments were used. And again, these are cases, these are canals that were used, that were prepared without any hand filing before using the reciproc instrument and without creating a glide path. I just want to remind you, for the MB canal in this case, just want to remind you that it can be extremely difficult to create a glide path in this case. It can be extremely difficult, no matter how skilled we are, to place a hand file at the working length. It can be extremely difficult to maintain patency, to create a glide path to a size 15, no matter how skilled we are. So imagine how difficult this can be for those who are not very skilled. This can be very challenging, and this is a case where the use of hand files can lead to complications, and again, regardless of our skills. This is a central incisor where the canal is completely visible from orifice to orifice on the radiograph. So this is a case where a number 30 hand file was able to go to length passively without any hand filing. This is a case that was done with the R50, exactly in the same manner. 1, 2, 3, take it out, irrigation, patency. 1, 2, 3, take it out, irrigation, patency. Once the R25, the R50 is at the estimated length minus 4 or 5 millimeters, a working length here will be determined. And we know in this case that the instrument will go straight because initially the number 30 hand file went straight. We just check the length and then we continue with the R50. As I said earlier, the reciproc instruments can be used in a brushing motion at any time of the canal preparation, at the beginning to obtain a straight line axis, or at the end to have a larger, a greater taper. And the instruments, the reciproc instruments, are very efficient in a brushing motion. Now, in a case like this one, if an apical enlargement is needed, it can be done very easily. Don't forget that the R50 has a size of 0.5 millimeter at the tip, and it has a 5% taper. So here, an increased apical enlargement can be done very easily with a 70 hand file. You don't have to use the 50, 55, and 60. You can go from the R50 to the 70 hand file very easily because of the difference in the taper. The 70 hand file has a 2% taper. The R50 has a 5% taper. And this is why the 70 hand file can go very easily if you need to have a larger canal preparation at the working length. This is another case that I showed earlier, where the canal is visible from orifice to orifice. A test was done with the hand files. The 30 hand file went very passively here, easily to the working length, and R50 was used for the canal preparation exactly in the same manner. This is a case where I increased the canal preparation size apically. I use here a number 70 hand file just after using the R50 to the working length. And again, this can be done very easily because of the difference in the taper between the hand instrument and the reciproc instrument. This is our case, interesting case. So the axis was obtained. The working length was, the estimated length was determined for the different canals. The stopper was placed at the estimated length minus 4 or 5 millimeters. I started with the MB canal, which is strongly curved. I used the R25. It reached the estimated length minus 4 or 5 millimeters. I took a hand file, number 8, straight. I put it in the canal with a watch-winding movement. It reached the working length. So I know that although the canal curvature is strong, this curvature is gradual. And I knew that I could use the R25 to the working length passively. On the other hand, in the distal ocular canal, I also I estimated the working length. I put the stopper at the estimated length minus 4 or 5 millimeters. I start using the R25, 1, 2, 3, take it out, 1, 2, 3, take it out, irrigation and patency. And even before I reached the estimated length minus 5 millimeters, the instrument was not advancing anymore. It was very difficult to make it advance. It was approximately at mid-length. So I was still even shorter than the estimated length minus 4 or 5 millimeters. When the reciproc stops from advancing, or when it becomes difficult to make it advance in the canal, when you feel that you have to put more pressure on the instrument to advance in the canal, this is when you have to stop using the reciproc instrument. And this also applies for a rotary instrument. Once you feel you have to put more pressure, once the instrument does not advance anymore, or once its advancement becomes more difficult, you remove the reciproc instrument. And this is a case where we have to create a glide path before we continue. So this is a case where I created a glide path using hand files, number 8, 10, and 15. After I created the glide path with the number 15 file, I took a straight hand file, number 15, put it in the canal. After creating the glide path, the number 15 hand file was able to reach length without having to pre-curve it. I knew that in this case, after creating the glide path, I was able to use the reciproc to the working length. Now, if after creating the glide path to a size 15, if I'm not able to place the hand file unless it is pre-curved. This is a case where the canal preparation in the apical third was to be completed with hand files. In some cases, just when you look at the preoperative radiograph, you can tell from the anatomy that you will not use a reciproc instrument to the working length. So in this case, there is a severe double curvature. So in this case, the reciproc instrument was used as far as possible, as long as it was advancing easily. At some point, it stopped from advancing. This is when I started using hand files, and I knew in this case that no matter what, I will not go into the second curvature with the R25. So this is a case where the reciproc instrument was used into the first curvature, just before the second curvature, and then the hand instruments were used to prepare the canal in the last few millimeters. By using the reciproc instrument up to this stage, the coronal obstacles were removed, and therefore the use of hand files, small hand files, in the second curvature became easier and it became safer. And this is the obturation of the root canal. So as I said earlier, these instruments are very efficient for retreatments. They can be used to retreat conventional gutta-perca obturations. For this, we would proceed as we usually do. We have to remove the bulk of the gutta-perca in the coronal third using an ultrasonic tip or a heat carrier. Frequently, we do not have to use a solvent like chloroform. This will depend on the density of the obturation. So after removing the bulk of the gutta-perca, we will use the R25 exactly as described before. 1, 2, 3, take it out, irrigation. 1, 2, 3, take it out, irrigation. Until the instrument reaches the working length. If at some point the progression of the instrument becomes difficult, or if the instrument does not advance anymore in the canal, then we'll have to use a solvent. Here I use chloroform, but in most of the cases you will see that chloroform or a solvent will not be needed. Once the reciproc, once the R25 has reached the working length, an increased apical enlargement is needed for retreatment cases. This can be done very easily with hand files or with the R40 or the R50 reciproc instrument. Once you have the R25 at working length, you can place a number 45 very easily to working length. Don't forget that the R25 has an 8% taper. The 45 instrument has only a 2% taper. So you can go directly from the R25 to a size 45 hand file. It will also be even easier to go from the R25 to the R40 or directly to the R50. And again, the reciproc instrument can be used in a brushing motion. This is a retreatment case that was started with the R25 and finished with the R40. The reciproc instruments are also very efficient and for the retreatment of plastic carrier-based obturations like Thermafil or Gutta-Master or right now the one Gutta or Gutta Flow. These instruments are used also in the same manner, exactly like we did for an initial canal preparation or for the retreatment. So the bulk of the gutta-perca is removed from the coronal third with a heat carrier or with an ultrasonic tip. then the instrument will be used in the canal in the same manner to remove the carrier. If at any point resistance is encountered, if the instrument does not advance, we never force on the instrument. This is when we have to use a solvent, and most rather we'll have to use hand files in a way to create a glide path to obtain patency, and then we can continue. So you can continue with the reciproc instrument to the working length. And after reaching the working length with the R25, apical enlargement will be required, and this again can be done very easily with hand files or with the larger reciproc instruments. Now I'm going to show you here a video clip showing the removal of a thermophil carrier. This video clip was edited, so you will not see the use of chloroform here, but this is a canal where I use chloroform to dissolve the gutta-perca. So the bulk of gutta-perca was removed with a heat carrier, just to make space for the reciproc to go into the canal. Then the reciproc is used in the same manner, 1 to 3 packs, very small in and out movements. We take it out, irrigate, or we use a solvent. Keep doing this until the instrument reaches the working length. And you will see that frequently the plastic carrier will come out in one piece, like now. If not, it will come out in debris like with dentine. But very frequently it will come out in one piece. After the instrument reaches length, as I said again, an increased apical enlargement will be required. And again here, I just want to remind you that regardless of the type of treatment that we are doing, whether it is an initial treatment or a root canal treatment, whether the canals are calcified or not calcified, severely curved or not severely curved, the technique is always the same. It does not change. And this is what makes it very simple, and this is what makes it very interesting for teaching purposes. It's an easy technique to teach and an easy technique to apply and to learn. In most of the cases, a solvent will not be required. And this is extremely important because when we use a solvent, studies have shown that we'll have much more gutta-perca remaining on the canal walls and in the dentinal tubules. Just imagine using a solvent in a canal. You see how fluid the gutta-perca will become in the canal, and you can imagine that it will be much more difficult to remove it than if we were not using, to remove it completely off the canal walls than if we did not use a solvent. No technique will be able to remove the obturation material completely, but studies have shown that when we do not use a solvent, we will have cleaner canals compared to canals where we use a solvent for retreatment. So that is also one other advantage of the reciproc instrument. Now, it is only fair to talk about the SAF instrument when we talk about single file reciprocation. I think you are familiar with the SAF instrument, the self-adjusting file. For me, the major issue with the self-adjusting file is that before using the SAF, we have to create a glide path to a size 20 or a size 30 hand file. Imagine the use of files up to size 20 or 30 in narrow canals or curved canals. And again, this is where the major problem is. This is when we will create problems. This is where we are more likely to create problems regardless of our skills. There's also at least one study that showed that that with the SAF system, the cleaning efficiency, the disinfection efficacy may be questionable, and that is because the SAF instrument does not allow a control of the apical enlargement. But for me, the major reason, the major problem with the SAF instrument is that we still have to use hand files up to size 20 or 30 before using the SAF instrument. And also, we cannot talk about single file reciprocation without talking about the new twisted file adaptive system. This is a system that was introduced just very recently by Cybron, where a twisted file is used mainly on rotation, and when needed, it will reciprocate. So there are 2 points that I want to discuss here. The first point is that this file is used mainly in rotation. When we use clockwise rotation, not clockwise, when we use continuous rotation, there is always a risk of binding. So there is a risk of torsional fracture. But also, according to Cybron, in this system, reciprocation is used when needed. What does that mean? That means in the difficult cases, in the curved canals where there is stress on the instrument, reciprocation is needed. And this, in a way, proves the concept, the efficiency, and it proves the rationale of single file reciprocation. So in this case, they are using reciprocation when the case becomes more difficult. So the question is, why do we want to use a rotary system also in reciprocation when we can obtain a safer result with using only single file reciprocation? And I also have to talk about single file continuous rotation, like the one shape from Micromega. I don't know if you are familiar with it. The issue here also is that we are using clockwise rotation, which means there is an increased chance of binding and there is an increased chance of torsional fracture, but also with the one shape, we have to create a glide path. Like with the twisted file adaptive, we have to create a glide path. So these are the major problems with these systems. Now, there are many papers right now that have been published on single file reciprocation that show the shaping ability and the cleanliness of canals, canals that were treated with either the reciproc instrument or the wave one. So there are no issues at all. They are comparable, at least comparable to clockwise, to continuous rotation. There are also studies that have shown that the bacterial elimination with the wave one and the reciproc instruments are, the bacterial elimination is as efficient as using the biorace sequence. So in this study, they showed that as long as the same amount of irrigation was used and the same canal preparation diameter was obtained, and if the canals were exposed to the same time to the irrigant, the bacterial elimination is comparable between single file reciprocation and continuous rotation. As you know, one of the questions is, how can we clean and disinfect a canal when we use only one instrument, when the canal preparation is fast? And studies like this one have shown that it is possible, as long as we expose the canal to the same amount of irrigation, as long as we expose the canal to a similar time to the irrigant, and as long as the canal preparation in both groups is similar. And there is also one other study that was also published recently that has shown that single file reciprocation is as efficient as clockwise rotation for the cleanliness of the canals. And there is also this very important study that indirectly showed that debris extrusion with the reciproc instrument is much less than with the rotary instruments. I'm not going to discuss this paper here, but this is a very important, probably one of the best papers that is published on debris extrusion. And in that paper, they showed that there is almost no debris extrusion with the reciproc system. Now, I've evaluated my cases over 3 years. I included in my evaluation 600 cases. All of the cases had access cavities with 4 walls. The caries was completely removed. The instrumentation, the canal preparation was done with the reciproc in the same manner as described. In some cases, I had to use a glide path. In some cases, I had to finish the canal preparation with hand files. I used sodium hypochlorite for the canal irrigation, and then a final rinse with sodium hypochlorite that was pumped in the canal with a cone, master cone. And then I did a single cone obturation, and all of the treatments that were evaluated here were done in one visit. And we made sure that the permanent restoration was placed within 1 to 2 weeks from the day when the root canal treatment was completed. And we made sure that this was done by contacting the dentist and the patient. And the results were quite interesting. So for the initial treatments without apical disease, the success rate was around 96%. The healing, I'm sorry, was around, success rate was around, yes, 96%. For initial treatments with apical disease, the healing rate was 93%, which is also comparable to what we find in the published studies. And more interestingly, the healing rate of root canal retreatments with apical disease was 91%. And this is much higher than what we see in the published studies. And that is most probably because the published studies were all done in a university setting by graduate students who are not very proficient probably at, in root canal treatments, whereas those cases were done in a private setting by me, who's, you know, very, in a way, proficient in root canal treatments. So this is a new concept, and definitely when there is a new concept, there are questions. And here I'm going to answer some questions, and these are the questions that I always hear. These are questions that I found on Roots. For those who are familiar with Roots, this is an online endodontic community. So I allowed myself to put some of what I saw on Roots here online because it was already made public. So there's, for example, this email from Dr. Stefanov to Marco Versiani, to Dr. Marco Versiani. Dr. Versiani, he studies root canal anatomy. So Dr. Stefanov was asking Dr. Versiani, he was telling him, when we see all the micro CT pictures referring to the work of Marco, how can we believe that a single file machine can clean those systems? We know from the literature, we know from Dr. Versiani's papers that almost any tooth had a root canal system. And you know, when you see root canal systems like this one, you understand that these are not systems that can be cleaned with an instrument. These cannot be cleaned with a reciproc instrument, this cannot be cleaned with a rotary instrument, no matter what type of rotary you're using. These systems can be cleaned with the irrigation. The final irrigation is the most important step, and this is what will clean these root canal systems. And one dentist from Denmark said it very well. He said that with reciproc, there is less time for irrigation. The treatment is faster, but we have more time for irrigation. So the time that we save on the canal preparation can be used at the end for a longer final irrigation. And we know from the literature that the final irrigation is the most important step for the cleaning, for the disinfection of the root canal systems. And with the reciproc, with single file reciprocation, we are increasing the time for a final irrigation. There are questions also about, the cleaning and the obturation of lateral canals. So this is a cross section made in a premolar. We know from many studies, we know that no matter what we do, no matter what technique we do, the lateral canals of infected teeth will always contain bacteria, they will always contain necrotic pulp tissue, no matter what we do. So whether we're using single file reciprocation or continuous rotation, these lateral canals will always remain infected. So the next question is whether with single file we can obturate lateral canals when we fill the canals. And definitely it is possible, because at the end, if these lateral canals were to be opened, this will be done because of the final irrigation. And I can show you many cases with lateral canals and different teeth, molars, premolars, different levels like here furcation or apical third, premolars in the apical third, molars, apical third, and middle third here, and this palatal root. Again, apical third, apical third. So it is possible to fill lateral canals if that is important, even when we do single file reciprocation. Here, lateral canals in the coronal third and in the coronal third. So filling lateral canals is not an issue. Again, the most important point here is that with single file reciprocation, we can increase the time for the final irrigation. And this is what will lead to cleaner canals. One other question that I found on roots was this case here, where Dr. Outine from Greece was questioning whether with reciproc we can prepare this canal where there is a large internal resorption. Again, these are not cases that these are not canals or resorptions that can be cleaned with an instrument, whether you're using reciproc or you're using clockwise rotation. These canals will be cleaned because of the irrigation. Again, with reciproc, we have more time for a final irrigation. And this is a case that I did, very similar to the previous case, where there is a large internal resorption. And again, no instrument can clean this internal resorption. It is the irrigation that will allow us to clean this area. And this is one other question that I took from roots, and this was from Dr. Diegers from Germany. He questioned on roots whether a severely curved canal like this one can be done with single file reciprocation. Well, I showed you many cases, but I'll show you even more cases. So in this case here, Dr. Degers mentioned that he used the M2 instruments, and look at his sequence. He used hand files, the C files. He used number 8, 10, and 12. Then he used the path files, 17, 18, and 19. So already 6 files for patency and glide path. Then he used M2 instruments from 15 to 30. And he says lots of recapitulation. I'm not going to comment on the fact that the canal preparation was short. I'm not going to comment on the fact that the obturation was short. I'm just going to comment on the fact that he used so many instruments in a canal like this one with a result that isn't that perfect. So the question is, why do we have to use so many instruments when we can do a case that is probably even more difficult with only one instrument, without any hand files, without a glide path? Don't forget that this instrument is similar to an F2 proTaper instrument. This instrument has a diameter of 25 at the tip and an 8% taper. And it's not only about one case. It is about a second case where the reciproc instrument was used here without any prior hand filing, without creating a glide path. It's not only about a second case, it's about many cases that are done exactly in the same manner in a reproducible way. Imagine an R25 going to length in this sharp apical curvature without, in this case, fortunately for me, without the need to use hand files and without the need to create a glide path. So for this case, again, the canal preparation was started with the R25. The R25 was taken to the estimated length minus 4 or 5 millimeters. A hand file was used in the canal. Fortunately for me, I did not have to P-curve it. It went straight to the working length. I knew then that I could, in this case, I could use the reciproc to the working length without any issues. And with this, I finish my presentation.